Erectile dysfunction is a topic that many people shy away from, but it's incredibly important to talk about openly because it affects millions of men worldwide and impacts physical, emotional, and mental health. Erectile dysfunction, or ED, is the inability to achieve or maintain an erection firm enough for sexual intercourse. It can happen occasionally from stress or fatigue, but consistent problems often signal deeper health issues.
There are many causes of erectile dysfunction, and understanding them is key to addressing it effectively. Physical causes include heart disease, high blood pressure, diabetes, obesity, and hormonal imbalances like low testosterone. These conditions interfere with blood flow, nerve function, and hormonal balance. Psychological factors like stress, depression, and anxiety also play a huge role in disrupting sexual arousal. Lifestyle choices have a big impact on erectile function too. Smoking, heavy alcohol use, lack of exercise, and poor diet can all damage blood vessels and decrease blood flow, including to the penis. Certain medications such as antidepressants or blood pressure drugs can cause ED as a side effect. If ED starts after a new medication, talk to your doctor rather than stopping the medication abruptly. Aging is another factor that contributes, but TM's not aging itself that causes ED. TM's the increased risk of health problems that comes with age. Keeping healthy as you age is crucial. To understand ED better, it helps to know the basic biology. Sexual stimulation triggers nerves to send chemical signals to the blood vessels in the penis, causing them to dilate and allow blood to fill two chambers called the corpora cavernosa. As these chambers fill with blood, the penis becomes firm and erect. Anything that disrupts this process, whether it's nerve issues, blood flow problems, or psychological blocks, can cause ED. Luckily, there are many treatments available. Oral medications like sildenafil and tadalafil increase blood flow to the penis. They are effective for many men but must be used under a doctor's guidance due to possible side effects. Therapy is very effective when psychological factors are involved. Speaking with a mental health professional can address anxiety, depression, or relationship issues contributing to erectile dysfunction. Often, combining therapy with medical treatment gives the best results. Lifestyle changes are incredibly empowering too. Quitting smoking, exercising regularly, eating a healthy diet, and managing stress can all significantly improve erectile function naturally. Hormone replacement therapy is an option if low testosterone is a factor. Other treatments like vacuum erection devices and penile implants exist for cases that don't respond to medication. It's important to remember that erectile dysfunction is a medical condition like any other. Seeking help is not a sign of weakness but of strength. Addressing it early can prevent worsening problems and even detect hidden health issues that need attention. Communication with your partner is critical. Being open about what RTM's happening can relieve anxiety and strengthen the emotional connection. When both partners understand the situation, intimacy often improves naturally. Preventing erectile dysfunction is possible by maintaining a healthy lifestyle. Regular exercise improves circulation and nitric oxide levels, crucial for strong erections. Managing blood pressure, cholesterol, and blood sugar can make a big difference. Simple changes like eating more fruits, vegetables, and healthy fats, walking daily, cutting back on processed foods, and practicing mindfulness reduce the risk of ED. Another often overlooked factor is the effect of pornography. Excessive use can alter arousal patterns, making real-life intimacy more challenging. Being mindful of media consumption can help maintain healthy sexual function and reduce performance anxiety over time. Natural supplements like ginseng and L-arginine are often promoted for ED, but caution is important. Some show promise, but many supplements are ineffective or even harmful if bought from unreliable sources. Always consult a healthcare provider before starting any natural remedy. Erectile dysfunction involves the body, mind, and heart. It's often a sign from the body that it needs care, not just physically, but emotionally and mentally too. Addressing erectile dysfunction with openness, curiosity, and proactive care leads to better sexual health and a better life overall. A satisfying, intimate life is part of overall well-being, and everyone deserves that. With the right approach, erectile dysfunction does not have to be a barrier. Taking the first step to seek understanding and support is often the hardest, but also the most powerful and life-changing move you can make. Thanks for watching the video. Subscribe Health/YouTube channel for more informative videos.